Hello and welcome back to Dr. Kim's Home Clinic. I'm Dr. Kim, and today I want to speak directly to every older adult who still cherishes the ability to see clearly, to read, to walk safely, and to look into the eyes of loved ones. As a physician specializing in senior health and preventive medicine here in the United States, I've seen far too many patients who remain sharp, active, and independent, yet quietly lose their vision, not because of disease or age, but because of small, daily choices they didn't realize were harming them. Let me be clear, not all vision loss is inevitable. Yes, our eyes do change with age, but many cases of poor eyesight, blurriness, or eye strain are preventable, especially when the cause is something as basic as what's on our plate. Some vegetables, while appearing healthy or even cooling, can actually contribute to long-term damage to the retina, optic nerve, and blood vessels of the eye, especially when stored improperly, cooked the wrong way, or consumed too frequently. So in today's video, I'm going to walk you through 5 vegetables I strongly urge older adults to limit or avoid, and I'll explain why. These are common everyday foods that may be quietly affecting your vision without you knowing. The good news? It's never too late to make changes. I've worked with countless seniors who reclaimed better vision, reduced eye discomfort, and even prevented further decline, simply by adjusting their daily habits at the dinner table. If you or someone you care about is experiencing blurry vision, light sensitivity, dry or watery eyes, or just wants to keep their vision strong for the years ahead, please stay with me. And if this message resonates with you, I kindly ask you to like this video and share it with others who might benefit. You never know. Your share could help someone avoid preventable vision loss. Let's take care of our eyes. Together, let's begin. Hello again, I'm Dr. Kim. Thank you for joining me here at Dr. Kim's Home Clinic, where we bring trusted, practical health guidance straight to your home, especially for those of you over 60 who want to live well, stay independent, and protect what matters most. Today, we're talking about something that's often overlooked: your eyesight. Many people assume vision problems are just a natural part of aging, but in truth, some of the foods we eat and the way we prepare them can quietly damage our eyes over time. Let's start with a serious warning. Here are 5 vegetables that can harm your vision. 1. Red amaranth, especially when left overnight. This beautiful, vibrant vegetable is common in many meals. But once it's cooked and stored overnight, its natural nitrates can convert into nitrites, a compound known to harm the tiny blood vessels that feed the retina. Over time, this can lead to macular degeneration, vision loss, and even cause dizziness and dangerously low blood pressure. Doctor's tip: never reheat or eat red amaranth dishes, especially soup, the next day. Always enjoy it fresh. 2. Raw water spinach, morning glory. Often enjoyed in salads or as a garnish, raw water spinach can harbor parasites or liver flukes, if not cleaned thoroughly, especially when sourced from stagnant or unregulated water. These organisms can cause low-grade inflammation in the blood vessels of the eyes, leading to blurred vision, eye fatigue, and discomfort. Doctor's tip: always cook water spinach fully, especially if you're over 60 or have a compromised immune system. 3. Wilted or rotten watercress. This is one of the most deceptive dangers. Older adults sometimes have trouble distinguishing between fresh and decaying greens, especially when buying in bulk or shopping alone. Spoiled or slimy watercress can harbor mold, yeast, and harmful bacteria that release toxins affecting the nervous system and the retina, resulting in dizziness, visual disturbances, or even nausea. Doctor's tip: avoid wilted, bruised, or slimy leafy vegetables altogether. When in doubt, throw it out. 4. Pickled radish or salty preserved vegetables. These traditional comfort foods may seem harmless, but they're often packed with sodium and nitrites. For seniors, that combination spells danger. High sodium intake can increase intraocular pressure, damage retinal vessels, and raise your risk of retinal bleeding or even stroke. Doctor's tip: replace these with lightly boiled, fresh vegetables. Your heart and your eyes will thank you. 5. Malabar spinach, Mang toi, too frequent or left overnight. This slippery, nutrient-rich veggie is common in many kitchens, but overuse, especially when overcooked or reheated from the day before, increases your intake of oxalates. Oxalates interfere with the absorption of zinc, calcium, and vitamin A, nutrients crucial for healthy vision. The result? Dry eyes, poor night vision, and gradual decline in eye function over time. Doctor's tip: enjoy Malabar spinach in moderation. Cook gently and avoid leftovers. Now let's turn to the good news: 4 vegetables that boost vision in older adults. 1. Carrots, nature's vision booster. Yes, it's true. There's a reason your mother always told you to eat your carrots. Carrots are packed with beta-carotene, which your body converts into vitamin A, a crucial nutrient that helps sharpen vision, especially at night. It also helps protect your cornea and reduces the risk of cataracts. But here's something many people don't know. Vitamin A doesn't just help your eyes. It also supports memory function in older adults. How to enjoy them: eat them raw with a bit of hummus, gently cook them in stews, or blend into a fresh juice. 2. Red bell peppers, a colorful shield for your eyes. These vibrant peppers are loaded with vitamins A and C, both essential for eye health. Vitamin C helps strengthen the delicate blood vessels in your eyes, protecting you from retinal bleeding, a common issue among people with high blood sugar or blood pressure. They also reduce oxidative stress, which can prevent early signs of macular degeneration and support healthy brain function, especially memory and mental clarity. How to eat: lightly sauté, grill, or combine them in a juice with carrots and apples for a vision-friendly tonic. 3. Kale, or other dark leafy greens. Kale, spinach, and similar greens are rich in lutein and zeaxanthin, 2 powerful antioxidants that are found in high concentrations in the retina. These compounds filter out harmful blue light and slow down the progression of age-related macular degeneration, a leading cause of blindness in seniors. They also reduce inflammation in the blood vessels and can enhance mental clarity, which often declines with age. How to eat: add a handful to your morning smoothie, sauté with garlic and olive oil, or lightly steam for a nutrient-dense side dish. 4. Ripe tomatoes, a red fruit with powerful benefits. Tomatoes are full of lycopene, an antioxidant that protects the retina and improves blood flow to the eyes and brain. They're also known to lower blood pressure and support memory retention, making them an excellent food for overall senior health, not just vision. How to eat: add fresh slices to your salad, blend into a refreshing juice, or eat whole. But try to avoid overcooking, which can break down some of the nutrients. Now, a word of caution: common cooking mistakes that can harm eye health. Mistake number 1: pouring out the boiled water. Many people boil vegetables and then toss the water down the drain, but that water contains vitamins A and C, essential for protecting your vision, strengthening the immune system, and supporting skin and tissue repair. Doctor's tip: don't throw it away. Use it as a vegetable broth for soup or drizzle it over brown rice or quinoa for added flavor and nutrition. It's a small habit with big benefits, especially for your eyes. Mistake number 2: stir-frying over high heat or using old oil. We all love the quick sizzle of a hot stir-fry. But when you use very high heat or old, reused oil, the antioxidants in your vegetables, like lutein and beta-carotene, can break down. Even worse, that combination can create toxic compounds that damage the retina, raise inflammation, and accelerate aging of the blood vessels in the eyes and brain. Doctor's tip: use fresh oil, cook on medium heat, and stir-fry for no more than 2 to 3 minutes. You'll keep the flavor and protect the nutrients your body needs. Mistake number 3: eating leftover greens. Here's something most people don't realize. Once vegetables are cooked and stored, especially leafy greens, they can start producing nitrites, compounds that, when reheated, may damage your liver, retina, and even increase the risk of certain cancers. Doctor's tip: cook just enough for one meal. If you must store leftovers, Eat them within 24 hours and avoid reheating more than once. Mistake number 4. Cooking with scratched non-stick pans or old aluminum pots. If you're using old cookware, especially scratched Teflon pans or worn aluminum pots, you might be exposing your food to heavy metals like aluminum or toxic chemicals like PFOA, which can affect the nervous system, damage the liver, and over time, increase chronic health risks. Doctor's tip: choose safe cookware like stainless steel, ceramic, or enameled cast iron. These options are durable, safe, and won't release harmful substances into your meals. Mistake 5. Taking calcium supplements with oxalate-rich veggies. Vegetables like spinach, chard, or Malabar spinach are healthy, but they contain oxalates, which can bind to calcium in your supplements and prevent the absorption of vitamins A and D, both critical for healthy eyes and bones. Doctor's tip: if you take calcium, space it out. Take your calcium supplements at least 2 hours before or after meals that include high oxalate vegetables. And finally, 5. Simple habits after meals to protect senior eyesight. 1. Drink warm water with a few drops of lemon. Right after a meal, a small cup of warm water with just a few drops of fresh lemon can go a long way. It helps the body absorb fat-soluble vitamins, supports gentle detoxification, and boosts circulation to the eyes, especially the delicate capillaries in the retina. Doctor's tip: avoid icy drinks. Warm water is easier on digestion and better for older adults. 2. Take a light 10 to 15-minute walk outdoors. After eating, many seniors tend to rest or sit back, and that's okay. But if you can, take a gentle 10 to 15-minute stroll outside. This light activity helps regulate blood sugar, enhances circulation, and allows your eye muscles to relax naturally after focusing on close-up tasks like reading or eating. Doctor's tip: bonus if you can walk in nature and let your eyes gaze at distant trees or the horizon. It's one of the best natural ways to prevent eye fatigue. Avoid screen time immediately after meals. I know many of us love to check our phones or watch TV after a meal, but doing so immediately after eating, especially for seniors, puts unnecessary strain on the retina, which is already vulnerable to blue light damage as we age. Doctor's tip: give your eyes a 30-minute break before turning to screens. Your digestion and sleep quality will thank you too. 4. Gently massage the eye area every evening. Each evening, take 2 to 3 minutes to gently massage around your eyes, your temples, brows, and under eye area. This improves blood flow, relieves tension in the eye muscles, and may help delay signs of aging and dryness that come with time. Doctor's tip: use your ring finger. It has the softest pressure, and apply a warm towel before massaging for extra relaxation. 5. Practice long-distance viewing. Look at the sky or trees. This is one of the most overlooked habits for eye health, training your eyes to focus on distant objects. Our eyes weren't meant to stay glued to books or phones all day. Practicing long-distance viewing helps preserve flexibility in your eye muscles and protects clarity and focus as you age. Doctor's tip: after each meal, look outside for 3 to 5 minutes. Gaze at clouds, tree branches, or rooftops in the distance. Your eyes will feel more relaxed and, over time, stronger. Before we close today, I want to leave you with one important message. Even the healthiest foods, like vegetables, can quietly harm your eyesight if the tastes are not prepared or eaten the right way. It's something many people never realize until it's too late. But here's the good news. By making a few thoughtful changes, avoiding the 5 risky vegetables, choosing 4 powerful vision-boosting ones, and cooking them the right way, you're not just protecting your eyes. You're also strengthening your heart, boosting memory, and investing in a future with more clarity, independence, and joy. As a doctor who's cared for older adults for decades, I want you to remember this. Your eyesight isn't just about seeing. It's about staying connected to the people and moments that matter most. You have more power than you think, and it starts right at your dinner table. If this video helped you, please click the like button, share it with someone you care about, and subscribe to our channel. We're here to walk with you, step by step, toward a healthier, brighter life. Until next time, stay well, stay informed, and take good care of those eyes. I'm Dr. Kim. Thank you for watching.